Hi class, welcome back. Just want to do a quick review here on the stomach. So just to recap what we've covered, when we look at the stomach, remember the stomach has hydrochloric acid, which helps to break down protein. How does the hydrochloric acid break down proteins? Well, in the stomach we have pepsinogen, but anything that ends in ogen means it's inactive. So pepsinogen has to be activated and become pepsin. In order to convert pepsinogen into pepsin, the main digestive enzyme that breaks down protein, we need hydrochloric acid. Hydrochloric acid has a pH of about 2.3. So if we look at the pH scale that goes from 0 to 14, anything from 0 to like 6.999 is an acid, and anything above 7 to 14 is a base. Hydrochloric acid is right here at about 2.3 pH, which is very acidic. Your blood pH, to give you an idea, is 7.4, which is slightly basic or alkalinic. So you have this hydrochloric acid in the stomach, which burns, right? It's heated. That's why we need lots of mucus in the stomach to protect it against the hydrochloric acid. The hydrochloric acid knocks off the ogen. Now we have pepsin. We could break down our proteins into amino acids. The hydrochloric acid is also needed to properly absorb B12, calcium, and iron. Now, if you're not absorbing B12, you're going to have lots of issues with something called methylation. And methylation, if you can't methylate properly, you'll have depression because you're not making neurotransmitters. You'll have bad headaches. You can have infertility, difficulty in losing weight. Um, there could be heart issues, stroke issues. Methylation is really important. So we want B12 absorption, calcium absorption. If you're not absorbing calcium, you can develop osteoporosis, and it's involved with also muscle contractions and nerve conduction. And iron, we know iron is needed for the mitochondria for ATP production. So if we don't have enough hydrochloric acid, you can have malabsorption of these very, very important nutrients. So think of all the people that are taking antacids. When they take antacids for heartburn or GERD, gastroesophageal reflux disease, right? The person thinks they have too much acid. So let's take an antacid. We lower the pH, or I should say, raise the pH to a more alkaline environment. And now you're not feeling the heartburn, but you're also not absorbing these nutrients and you're not breaking down your proteins. Lots of complications from that. And you will learn that too much of something or too little of something creates the same symptoms. So the person that has heartburn that jumps to the conclusion that it's a result of too much hydrochloric acid that takes the antacid could do a lot of harm, when in fact most people have too little stomach acid creating heartburn. So the question is, how can having too little hydrochloric acid create heartburn? Because remember, these muscles, the longitudinal muscle, the circular muscle, and oblique muscle, these three big muscles of the stomach, when there's too little acid, these three muscles are going to contract really, really hard to mix whatever food is in the stomach. Now it's called chyme, right? In the stomach, in the mouth, it was called bolus. Food in the mouth as it's being broken down is bolus, but when it's broken down by the enzymes in the stomach, it's called chyme. So now you got the chyme in the stomach with a little hydrochloric acid. So the stomach muscles are going to contract really, really hard to mix the chyme with whatever hydrochloric acid is there. And the hydrochloric acid is going to splash upward. And if the tone here, if the tone of the lower esophageal sphincter is weak due to smoking, coffee, stress, right? Too much coffee, too much stress, too much chocolate, excessive weight. These things weaken the tone of the lower esophageal sphincter. Now you got acid splashing up and you get gastroesophageal reflux disease from having too little acid. Yes, it can happen with too much, but it can also happen with too little. Hydrochloric acid is also needed to neutralize some of the bacteria in the stomach. It's bactericidal. When you have bad bacteria overgrowth, we call that dysbiosis. We want a balance between good bacteria and bad bacteria. Dysbiosis, bacterial overgrowth, is not a good thing. So the stomach is holding food. It digests food both physically and chemically, and it delivers chyme into the small intestine. We have three parts of the small intestine: the duodenum, jejunum, and ileum, and I'll go over those shortly. The duodenum, jejunum, and ileum. And then enzymatically, the stomach digests proteins due to the pepsin, but of course, we need the hydrochloric acid to do that. Now, one thing that the stomach also secretes besides hydrochloric acid is something called intrinsic factor. Something called intrinsic factor. So, intrinsic factor binds with B12. The intrinsic factor is a transporter, and it takes B12 from the stomach, it brings it to the ileum for absorption. Pretty neat how that works, okay? Okay, and we spoke a little bit about the poisons and the stomach, where if you're consuming something that's poisonous, then what happens is this pyloric sphincter right here will shut. This smooth muscle here shuts, and reverse peristalsis happens, and you can vomit out. What happens with alcohol is absorbed primarily from the stomach. So by the time there is toxic levels that's reached by the nervous system, the body gets this little delayed reaction. Now where it's toxic levels, your body starts gagging and you try to vomit, but nothing's coming out because there's nothing in the stomach. You just dry heave. Okay, because remember, it's absorbed by the stomach. All right. If you consume, let's say you're out biking and you consume some berries with your kids and you realize, oh, we shouldn't have eaten those. Again, if they're healthy, the pyloric valve opens and a little bit of those berries go into the duodenum and you could start digesting it. But if they're poisonous, it shuts. And again, reverse peristalsis leads to vomiting. So, in terms of cancer of the stomach, it's due to accelerated growth of the abnormal epithelial. And this holds true for cancer of any part of the digestive tract. It's always an accelerated growth of abnormal epithelial tissue. And the cancer is created commonly from smoking and alcohol, gastroesophageal reflux disease, spicy foods, pickled foods, salt cure foods, fried foods, smoked foods, all known long term, not short term, of course, but long term to be cancer causing, as does vitamin A deficiency, zinc deficiency, and molybdenum deficiency. Also, an unhealthy balance between the good and bad bacteria. And we know overgrowth of bad bacteria is called dysbiosis. So, when do we know that someone is going through stomach cancer? Well, there is excessive weight loss, typically 10 to 15 pounds in a 2 week period, or 30 pounds in a month. When you see someone and they're losing weight, you go, wow, you look great. You've lost so much weight. What have you done? And they said, nothing. I'm not doing anything intentionally. That's usually a red flag for some form of GI cancer. They also have stomach pain and, interestingly enough, back pain. Even though it's the stomach, they have back pain as well. They have hematemesis, which is a term that means that when they vomit or throw up, it looks like coffee grinds in the vomit. They'll also be yellowish. That's what jaundice means. Jaundice means they look yellow. The skin will look yellow. And if you have a darker complexion and you can't see yellowing of the skin, you can always use the eyes, the white of the eyes for that to see yellowing. The treatment for it is typically remove the stomach, gastrectomy, radiation, or chemotherapy. Okay, I'll take a break here. When we come back, we'll talk about hiatal hernias.